Blood pressure suddenly becomes high? You don't understand the reasons for high blood pressure. Today I will explain to you the inside story of high blood pressure. Stop blaming your salt shaker. Stop blaming your genetics. Stop blaming stress. Because there is a hidden trigger for high blood pressure sitting in your gut right now. And almost no doctor takes the 90 seconds required to explain it to you. I'm going to explain it to you today in plain language. And by the end of this video, you're going to understand something about your own body that most physicians never mention in a routine checkup. Here's the fact that should stop you in your chair. A large population study following more than 3 million adults, published in the Journal of the American Society of Nephrology, found that people with chronic constipation had a 23% higher risk of a cardiovascular event, including heart attack, and a significantly elevated risk of stroke compared to people with normal bowel movements. 23%. That is not a rounding error. That is not a coincidence. That is a physiological chain reaction happening inside your abdomen every single time you sit on the toilet and strain. I'll explain exactly why in a moment, and full references for every study mentioned in this video are linked in the description below, so you or your doctor can review them. Now, before we go further, I want to tease you with something, because I don't want you clicking away in the next 30 seconds. Item number 2 on today's list is a food sitting in almost every senior's refrigerator right now, something your doctor may have actually recommended to you for heart health. And it is quietly one of the most constipating, blood pressure-raising foods a person over 60 can eat. I'll tell you exactly what it is and exactly what to replace it with later in this video. Stay with me. Before we dive into the full breakdown, I want to ask you something, because I read every single comment on this channel, every one, and I want to know who's watching. Tell me your age in the comments below, and tell me this: how long has it been since you had a truly normal, comfortable, complete bowel movement, without straining, without waiting, without wondering if today would be the day it finally happened easily? Just answer honestly. You'd be amazed how many people your age are dealing with the exact same thing in silence, too embarrassed to bring it up with their own doctor. This is a judgment-free zone. Now let's get into it. My name is Dr. Ryan Coldridge. What matters is that I've spent decades in internal medicine, working almost exclusively with patients over 60. And I can tell you that the connection between the gut and blood pressure is one of the most underdiagnosed relationships in aging medicine. Most primary care visits last somewhere around 15 minutes. In that time, a doctor is expected to review your medications, check your vitals, address whatever new complaint brought you in that day, and somehow also cover long-term prevention. There simply isn't room in that appointment to sit down and explain how your bowel habits are quietly shaping your cardiovascular risk. That's exactly the gap this channel exists to fill. So today I'm going to walk you through the whole process, from the least powerful factor to the single most powerful one. We're counting down from 6 to 1. 6 foods and habits that quietly cause constipation and drive your blood pressure up. What to replace them with, how to fix constipation at the root, and exactly which foods lower blood pressure while keeping you regular. I want you to think of your body for the next few minutes like a household plumbing and electrical system that share the same wall. When there's a blockage in the pipes, the pressure in that entire wall changes, and it doesn't just stay contained to the pipe itself, it pushes against everything nearby, including the wiring. Your gut and your circulatory system share that same wall. Let's start at number 6. Number 6. Refined, low-fiber carbohydrates, the slow poison hiding in comfort food. Here's a sentence that might make you angry. The white bread, white rice, and pastries that have comforted you your whole life are, after age 60, working against you in a very specific and measurable way. A study out of Harvard's Department of Nutrition tracked dietary fiber intake across tens of thousands of adults and found that those consuming less than 15 grams of fiber per day, which describes the majority of seniors eating a typical Western diet, were nearly twice as likely to report chronic constipation compared to those eating 25 to 30 grams daily. Refined carbohydrates strip away the bran and fiber layer during processing, leaving behind starch that digests fast, spikes blood sugar, and leaves almost nothing behind to bulk up stool in the colon. Here's why this hits harder after 60. As we age, the muscles lining our intestinal walls undergo the same kind of decline we see in our arms and legs, a process researchers call sarcopenia when it happens to skeletal muscle. But the smooth muscle of the gut experiences a parallel slowdown. Intestinal transit time, meaning how long it takes food to move from one end to the other, can slow by 30 to 40% between your 30s and your 70s. When you combine a naturally slower gut with a low-fiber diet, waste sits in the colon far longer than it should. And when waste sits, water gets reabsorbed out of it, making stool harder, drier, and much more difficult to pass. That difficulty leads directly to straining, and straining is where the blood pressure danger begins, something we'll cover in full at number 2. There's also a second mechanism worth understanding here, one that connects directly to blood pressure rather than just the gut. Refined carbohydrates cause rapid spikes in blood sugar, and repeated blood sugar spikes over years have been associated in research with increased arterial stiffness and low-grade inflammation in the lining of blood vessels called the endothelium. A healthy endothelium releases a compound called nitric oxide, which signals blood vessels to relax and widen. Chronic blood sugar spikes appear to blunt that nitric oxide response, meaning your blood vessels become less able to relax on demand, a problem that compounds with the natural arterial stiffening that already comes with age. So the same slice of white toast that's slowing your colon down may also be quietly stiffening the very vessels responsible for regulating your blood pressure. Practically speaking, here is what to do. Swap white bread for 100% whole grain or sprouted grain bread. Swap white rice for barley, farro, or even just leaving the skin on potatoes. Aim to add 5 grams of fiber per week rather than jumping straight to 30 grams overnight, because a sudden fiber increase in an underhydrated senior can actually worsen bloating and constipation temporarily. A good starting target is 25 grams of fiber a day for women and 38 grams for men, though very few adults over 60 currently reach even half of that. Foods like oats, lentils, chia seeds, and raspberries are some of the easiest, gentlest ways to build toward that number without overwhelming a sensitive digestive system. The synergy tip here is simple but critical. Fiber without adequate water is like sawdust in a pipe. It can make things worse, not better. For every gram of fiber you add roughly an extra ounce of water that same day. Get this pairing right, and you've already solved a meaningful piece of the puzzle. But there's something even more common than refined carbs quietly working against you, and it's the item I teased earlier. Let's move to number 5. Number 5. Excess dairy and calcium supplements, the heart-healthy advice that backfires. This is the one I promised you. So many patients over 60 have been told by well-meaning doctors to increase dairy and take calcium supplements to protect bone density, especially after menopause or in men with early osteoporosis risk. But here's what almost nobody explains. Calcium in supplement form and dense dairy products like hard cheese are among the most well-documented constipating substances in clinical nutrition. A review published in the World Journal of Gastroenterology found that calcium supplementation, particularly at doses above 500 milligrams taken without magnesium, was associated with significantly slower colonic transit time and increased reports of hard, difficult-to-pass stool in adults over 65. Why does this matter so much for blood pressure specifically? Because calcium and magnesium work in opposition inside the smooth muscle of your intestines and your blood vessels. Calcium tells muscle to contract, magnesium tells muscle to relax. When you flood the body with calcium and don't provide enough magnesium to balance it, you get two problems simultaneously. The intestinal wall contracts too tightly and inconsistently, contributing to constipation, and the smooth muscle lining your blood vessels also stays more contracted than it should, which is a direct contributor to elevated blood pressure. This is why some research has linked high-dose, unbalanced calcium supplementation with modest increases in blood pressure readings over time, especially in older adults whose kidneys are less efficient at clearing excess mineral load. Kidney filtration capacity itself declines by an estimated 30% between age 40 and age 70, meaning minerals we take for granted in our 40s become much harder to process later in life. The fix isn't to stop calcium altogether. Bone health still matters, but to rebalance it. If you take a calcium supplement, take it with a 2-to-1 or even 1-to-1 ratio of magnesium, ideally magnesium glycinate or magnesium citrate, which are gentler on the stomach than magnesium oxide. Timing matters too. Take calcium in the morning with food and consider magnesium in the evening, since magnesium has the added benefit of relaxing the nervous system and can support better sleep. It's also worth reviewing with your doctor or pharmacist whether you actually need a separate calcium supplement at all, since many seniors are already getting meaningful calcium through fortified foods, dairy, and leafy greens, and doubling up unnecessarily is exactly what tips this balance in the wrong direction. The synergy tip. Pair your calcium-containing meal with a source of vitamin K2, found in fermented foods like natto or aged cheese in moderation, which helps direct calcium toward bone rather than letting it linger in soft tissue and blood vessels. Let's move to number 4, because this next one surprises even medical professionals. Number 4, chronic dehydration, the silent multiplier nobody feels coming. Here's a fact that should be taught in every senior wellness class and rarely is. Our sense of thirst becomes measurably less reliable as we age. Research published in the American Journal of Physiology found that older adults experience a blunted thirst response, meaning that by the time you actually feel thirsty, you may already be 5 to 10% dehydrated at the cellular level. Compare that to a younger adult, who typically feels thirst at just 1 to 2% dehydration. This means most people over 60 are walking around mildly, chronically dehydrated without any obvious warning sign. Why does this hit the gut and blood pressure together so hard? Your colon's primary job in the final stage of digestion is to reabsorb water from waste before elimination. When your whole body is running on a water deficit, the colon becomes more aggressive about pulling water out of stool to protect your overall hydration status. And that leaves you with harder, drier, more difficult stool, textbook constipation. At the same time, mild chronic dehydration causes your blood vessels to constrict slightly as a protective mechanism to maintain blood pressure and organ perfusion with less fluid volume available. This vessel constriction is one of the most overlooked, non-dietary contributors to elevated blood pressure readings in older adults, and it's compounding with the constipation happening in the gut at the very same time. 2 problems. 1 root cause. There's another layer to this worth mentioning because it explains why so many seniors underestimate their own dehydration. Total body water as a percentage of weight naturally declines with age, dropping from around 60% in a younger adult to closer to 50% by your 70s, largely due to the gradual loss of muscle mass, since muscle tissue holds significantly more water than fat tissue does. This means the same amount of fluid loss, through sweating, through certain medications like diuretics prescribed for blood pressure itself, or simply through a hot afternoon, represents a larger percentage shift in an older body than it would in a younger one. It's a smaller reservoir working with the same daily demands. Here's the practical fix, and I want you to actually do this, not just nod along. Don't rely on the feeling of thirst. Instead, aim for roughly half your body weight in pounds in ounces of water spread across the day. So if you weigh 160 pounds, that's roughly 80 ounces, or about 10 cups. Front-load your hydration earlier in the day so you're not up all night using the bathroom. A useful trick many of my patients have adopted. Drink 1 full glass of room-temperature water first thing upon waking, before coffee, before anything else. This single habit stimulates something called the gastrocolic reflex, essentially your gut's built-in wake-up signal that triggers a bowel movement, and it rehydrates your blood volume before caffeine, which is itself mildly dehydrating, enters your system. If plain water feels unappealing or you find yourself forgetting, herbal teas, water-rich fruits like watermelon and oranges, and clear soups all count toward your daily total and can make reaching that number feel far less like a chore. The synergy tip. Add a pinch of a low-sodium electrolyte mix or a slice of lemon to your morning water, because water alone can pass through you quickly without properly rehydrating your cells if your electrolyte balance is off. Sodium, potassium, and magnesium help pull water into your tissues rather than straight through your kidneys. Now, before we get into the top 3, which is where the real power moves are, I need to pause for a moment. If this video is genuinely helping you understand your own body better, Please take 5 seconds right now and hit that like button. And if you haven't already, subscribe to this channel. I put out videos exactly like this every single week, specifically for people over 60 who are tired of vague advice and want real answers about what's happening inside their bodies. Subscribing costs you nothing, and it helps this information reach the thousands of other seniors out there dealing with exactly what you're dealing with, often in silence. All right, let's get into number 3, because this is where things get serious. Number 3, sedentary time and low potassium. The movement-mineral connection almost nobody explains properly. I want to tell you about a patient I worked with. I'll call him Robert, 68 years old, retired from a factory job in Ohio. Robert came to me frustrated. He was on 2 blood pressure medications, still running higher than his doctor wanted, and he'd been dealing with constipation for so long, he considered it just part of getting old. When we looked at his daily routine, Robert was sitting for roughly 11 hours a day, watching television, reading, sitting at meals, and his diet included almost no potassium-rich foods, very little in the way of bananas, potatoes with skin, leafy greens, or beans. Within 8 weeks of 2 specific changes, which I'll explain in a moment, Robert's constipation resolved almost completely, and his systolic blood pressure, the top number, dropped by 14 points. Enough that his doctor was able to begin tapering one of his 2 medications under medical supervision. Here's the science behind what happened to Robert, and it applies to the aging body specifically. Physical movement stimulates something called peristalsis, the wave-like muscular contractions that move waste through your intestines. When you sit for extended periods, those contractions slow dramatically. Some research estimates a reduction in colonic motility of up to 20% after just a few hours of continuous sitting. Combine that with age-related smooth muscle decline, and you have a colon that is doubly slowed down. At the same time, potassium plays a critical direct role in blood pressure regulation because it helps your kidneys excrete excess sodium, and it helps relax the walls of your blood vessels from the inside. A landmark analysis published in the British Medical Journal found that increasing potassium intake was associated with a meaningful reduction in both systolic and diastolic blood pressure, with effects comparable in some studies to low-dose blood pressure medication, particularly in adults with below-average potassium consumption, which describes a large percentage of people over 60 in Western countries. Robert wasn't lazy, and I want to be clear about that, because so many of my patients blame themselves the moment sitting comes up in conversation. He had simply built a life, in retirement, around low-effort routines, the same way many of us do without noticing. What changed things for him wasn't a dramatic overhaul. It was 2 small, specific, repeatable habits layered onto the day he already had. Practically, here's the 2-part fix that worked for Robert. First, movement. Not a marathon, just 20 to 30 minutes of walking, ideally split into 2 10 to 15-minute walks, one after breakfast and one after dinner, timed specifically to take advantage of the natural increase in gut activity that happens after eating, called the gastrocolic reflex, the same one I mentioned earlier. If walking outside isn't accessible to you because of weather, mobility, or safety concerns, marching in place near a chair for support or doing a few slow laps around your living room produces much of the same benefit. The goal is simply to activate the large muscles of the legs and core, which in turn stimulates the gut. Second, potassium. Aim to include 1 potassium-rich food at 2 of your 3 daily meals: a banana, a baked potato with the skin left on, cooked spinach, white beans, or an avocado. One important note, and this matters medically: if you're on a potassium-sparing diuretic or an ACE inhibitor for blood pressure, talk to your doctor before dramatically increasing potassium intake, since those medications already raise potassium levels, and the combination needs to be monitored rather than adjusted on your own. The synergy tip: pair potassium-rich foods with your short post-meal walk, because movement increases blood flow to the gut and muscles, which helps your body actually absorb and utilize that potassium more efficiently, rather than simply passing it through. Now, we are entering the final 2, and item number 2 is the one I promised you, and it directly explains the mechanical link between straining and stroke risk. Let's go. Number 2, the strain. How the toilet itself becomes a cardiovascular event. This is the one every senior needs to understand, because it explains exactly why chronic constipation is not just uncomfortable, but genuinely dangerous for the heart and blood vessels. When stool is hard and difficult to pass, most people instinctively do something called the Valsalva maneuver. You take a breath, close your throat, and bear down hard, tightening your abdominal muscles to force a bowel movement. Think of it like trying to force water through a garden hose by pinching the end shut and squeezing the hose harder. The pressure has to go somewhere, and it builds dramatically upstream. Here's what's actually happening in your body during that strain. Research using continuous blood pressure monitoring during bowel movements found that systolic blood pressure can spike by as much as 50 to 70 points during a hard strain, meaning someone with a resting blood pressure of 140 could briefly spike to 190 or higher for the duration of that strain. In a healthy 30-year-old, blood vessels are elastic enough to absorb that spike without major consequence. But after 60, arterial walls naturally stiffen, a process related to declining elastin fibers and increased arterial calcification, sometimes called vascular aging. And by age 70, arteries can be up to 50% stiffer than they were at age 30. A stiff artery cannot absorb a sudden pressure spike the way a flexible one can, which is why repeated straining, day after day, year after year, has been linked in multiple studies to increased risk of small vessel damage in the brain, and in more severe cases has been documented as a trigger for hemorrhagic stroke and cardiac events in vulnerable individuals, particularly those with existing hypertension or arterial plaque. I want to tell you about another patient, Margaret, 74 years old, from a small town outside Austin, Texas. Margaret had been dealing with constipation for over a decade and had actually had 2 separate incidents where she felt lightheaded and saw spots in her vision immediately after straining on the toilet. Incidents she never reported to her doctor because she assumed they were unrelated, just getting older. When we discussed the Valsalva mechanism and she understood what was actually happening to her blood pressure in those moments, it was like a light switched on. We restructured her diet using several of the strategies in this video, and within 6 weeks, Margaret was having soft, easy bowel movements without straining, and those lightheaded episodes stopped entirely. She told me she wished someone had explained this to her 20 years earlier. So what do you actually do about this one? First, never ignore the urge to go. Waiting makes stool harder and increases the need to strain later. And it also means the natural reflex weakens over time if it's repeatedly overridden, since the nerves signaling that urge become less sensitive the more they're ignored, similar to how any signal fades with disuse. Second, use a small footstool, 6 to 8 inches high, in front of the toilet to elevate your knees above your hips. This simple positioning change straightens the angle of the rectum and has been shown to reduce the force needed to pass stool significantly, essentially removing the need to strain at all in many people. You don't need a special product for this. A sturdy step stool or even a stack of thick books works perfectly well. Third, never hold your breath while trying to have a bowel movement. Breathe out slowly and steadily instead, which prevents the blood pressure spiking effect of the Valsalva maneuver almost entirely. If you take blood pressure medication and find yourself consistently straining despite everything discussed today, that is genuinely worth flagging to your doctor directly, since it may indicate your stool is harder than diet changes alone can resolve, and a short-term doctor-guided stool softener may be appropriate while the underlying habits take hold. The synergy tip. Combine the footstool technique with the morning water habit from earlier, timing your bathroom visit about 20 to 30 minutes after your first glass of water and breakfast, when the gastrocolic reflex is naturally at its strongest. Get this right, and you remove one of the single most dangerous mechanical triggers linking your gut to your cardiovascular system. And now we've arrived at number 1, the most powerful factor of all, the one that ties everything else in this video together. Number 1, the magnesium and fiber synergy, the true root of the gut-heart connection. Everything we've discussed today, the refined carbs, the calcium imbalance, the dehydration, the sedentary time, the straining, all of it converges on one single, underappreciated mineral, magnesium. And here's a statistic that genuinely shocked me when I first came across it in the research. Studies estimate that up to 60% of adults over the age of 60 are not getting adequate magnesium in their diet. And some research suggests actual measurable magnesium deficiency, not just low intake, may affect a substantial portion of older adults, particularly those on common blood pressure medications like diuretics, which actively flush magnesium out of the body, along with excess sodium and water. Here's why magnesium sits at the very center of both constipation and high blood pressure. Magnesium draws water into the intestines through a process called osmosis, softening stool naturally without artificial stimulant laxatives. It's one of the reasons magnesium citrate is used clinically as a gentle, effective constipation remedy. But magnesium's second job is arguably even more important for your cardiovascular system. It acts as a natural calcium channel blocker, meaning it helps the smooth muscle lining your blood vessels relax rather than contract, which directly lowers peripheral resistance, the force your heart has to push against with every single beat. A meta-analysis published in the journal Hypertension, reviewing dozens of clinical trials, found that magnesium supplementation was associated with a meaningful reduction in both systolic and diastolic blood pressure, with the strongest effects observed in individuals who started with lower magnesium levels to begin with, which, again, describes a huge percentage of people over 60. If this video gave you something you didn't know before today, do me one favor, subscribe to this channel, because I release new videos exactly like this one every single week, built specifically for people who want real, evidence-based answers about the way their bodies as they age. We'll be covering related topics soon, including the specific connection between sleep quality and blood pressure after 60, and a deeper breakdown of which blood pressure medications tend to affect magnesium and potassium levels the most, so you know exactly what to ask your doctor about at your next visit. And I want to hear from you directly in the comments. Which of these 6 factors do you think has been affecting you the most? And are you ready to try the footstool technique or the morning water habit this week? Tell me honestly, I read every single comment, and I'll see you in the next video.